welcome to our informational session for our Interprofessional Clinicians Program funding. It's great to see all of you. My name is Dr. Annette Nasser, and I'm one of the nurse scientists in the Department of Nursing Research and Evidence-Based Practice in the Center for Professional Excellence and Inquiry. I'm also a member of MCHRI. I'd also like to introduce our Senior Program Manager, Kim Stern, and May Zabeda, who also is I'm not sure of your full title, but works at MCHRI at the intake area of MCHRI. So thank you, both of you, for your support on this. I have a small PowerPoint that I think will help to just introduce this funding source to all of you. But before we begin, if we could just go around and introduce everyone, so I know kind of what department you're coming from, that would be great if you don't mind. Why don't we start with music therapy team? That looks really exciting.
So we are three out of 4 music therapists here at Stanford Children's. I'm Emily. I'm the music therapist on HEMONC and stem cell transplant.
Nice.
I'm Alexandra. I'm the music therapist on the 3rd floor.
And I'm Dan. I'm the music therapist for the cardiac units on the 2nd floor.
Wonderful to see you. Ronit, could you introduce
yourself? Hi, I'm Ronit. I'm the genetic counselor.
Sorry.
Oh, that's okay. I'm a genetic counselor and I work in fertility.
Great. Nice to have you. Nina.
Hi, my name's Nina. I'm a nurse in the intermediate care nursery. Nice to meet you.
Nice to meet you. Michelle.
Hi, I'm Michelle Diamond. I'm a pediatric physical therapist in the outpatient rehab clinics in Menlo Park.
Great. Nice to have you. Eric.
Hi, I assume we're doing introductions.
Yes, that's right.
So, hello everyone. My name's Eric Stidley. I'm a nurse practitioner. I work primarily with child psych over in Mountain View, but also dabbling in some stuff with the treatment center at our main hospital.
Nice to see you, Eric. Thanks for being here. And who else? There's someone on a phone with 1408660. I'm not sure who that is.
I'm Magda. I am Magda. I'm a case manager in maternity. Are you able to hear me?
Yes. Thank you.
Okay.
Nice to meet you. Great. Kim, do you want to introduce yourself, or do you feel pretty well introduced?
I think you did a good job.
Okay. And May, anything extra you'd like the group to know about you?
Yeah, I can actually provide my title since
Thank you.
since there was some questions about it. But I'm with MCHRI and I'm a clinical research manager. I oversee a pool of research coordinators, and they have a couple right now helping with the first ICP program, and so I'm here to help answering questions regarding our support.
Thank you, May. All right. So I thought I would just start with a really quick, like maybe 5-minute just overview of the program, and then we can answer any of your individual questions. So I'm going to share my screen. Okay. May, can you see that okay?
Yeah, I could see it.
Or Kim, okay, thank you. All right, so again, this funding source is called the Interprofessional Clinicians Program. We are on our 2nd cycle of applications. The Stanford Maternal Child Health Research Institute, MCHRI, and the Department of Nursing Research and Evidence-Based Practice partner on this program, and I'll get into the details in a moment. Again, my name is Annette Nasser. I'm one of the nurse scientists here at Stanford Children's, and I am the panel chair. Our vice panel chair is Dr. Kim Pike-Grimm, who is another nurse scientist, and then our senior program manager is Kim Stern at MCHRI. Just some important dates that I just want to get out right in the open from the start is the letter of intent, which I'll talk a little bit about, is due January 22nd. You will then be invited to do a full proposal, which will be due May 6th, 2024. And then the award start date is not until July 1st, 2024. And all of this can be found on MCHRI's website, which I'll give you that address in this slide deck. So again, this is a partnership, and their important dates are up top that I just reviewed. This Interprofessional Clinicians Program offers funding to non-faculty clinicians. Those are people who work at Stanford Children's but do not have faculty appointments. And it's to support clinical research focused on any approaches that advance or improve patient care outcomes at Stanford Medicine Children's Health. The recipients will receive up to 200 hours of MCHRI clinical research support services, which May can delve into if we have time. It will also allow the investigator to have 200 hours of protected time away from clinical duties through the Department of Nursing Research and Evidence-Based Practice per grant. And then you will also be given up to $5,000 for research support, which could include supplies or equipment. Who can apply? Any interprofessional non-faculty clinician are invited to participate in an innovative, groundbreaking research study that advances science and focuses on maternal child health. Applicants may include patient care services, child life, rehab services, and pharmacy. You must be a Stanford Medicine Children's Health employee, and you must be full-time. And you must also be so you have to be able to be employed here. You don't have plans on leaving within at least the next 2 to 3 years, if possible. We have our information session today. We are possibly going to be adding some informational sessions in December, but more to come on that. Again, this QR code will take you right to the MCHRI website, and or the website address is there too. Our inaugural Interprofessional Clinician recipients from last year, our first recipients, are Kylie Clues. She comes from PT, and the title of her study that is now currently funded, they've just completed a year. It's an 18-month funding source. And the title of her study is Abnormal Vestibular Ocular Motor Function and Symptomology in Adolescents with Concussion. And Fiona Wang, who is a PA in labor and delivery, and she's looking at the impact of uterine devices on endometrial lining in no-porous women. And these are our two current recipients. Again, this is just additional flyer and information on the program, a little clearer than the first flyer. And again, the dates are here for you, and it's pretty repetitive of the first one, but just in a clear format. Projects must be novel, and the field can be a continuation or an expansion of an investigator's current research. These are research areas that we are looking to fund: practice changes and impacts on outcomes, social determinants of health, artificial intelligence in the clinical setting, patient care models in the inpatient outpatient settings, and work wellness and resiliency. Please note that student research projects are not eligible for ICP funding. Quality improvement projects are not appropriate for this mechanism as well. They all need to be research. We have two categories in the ICP. One is category 1 for a new researcher, someone who's never published or never run a study. The specific guidelines are on the website. And category 2 is an experienced researcher, someone who has been first author on a paper or has led a research study. Again, we are available to answer any questions you may have. I'd also like to invite you, if you'd like to do a consultation with one of our nurse scientists here in the Department of Nursing Research and Evidence-Based Practice, we're happy to assist you with any questions. Our consultations are available for ICP funding and can be found at this website address or just on our intranet under research. And we'd be happy to consult with you. And that's a really quick summary of the program. The application is pretty detailed and pretty rigorous. If you go to MCHRI's website and you go to the application, you'll find that there's several aspects of the application. One in particular that I'd like to just highlight is that a letter of intent is one of the first steps that it needs to be accomplished as an applicant. A letter of intent is it's not too detailed. It's detailed, but it's not overwhelming. But you must have a mentor sign off on the letter of intent. And that mentor must have an academic appointment in the School of Medicine so they can help you with the IRB part of the application and also guide you through the research study and the design. So to help mentor you through then your letter of intent is submitted. We have a review panel, which is interprofessional, that will review the letters of intent and then invite the applicant to submit a full proposal, which is due in May. So you have a lot of time to get statistical support or consultations before you submit the final proposal. So a lot of moving parts, but I'm happy to answer any questions you may have. Kim or May, do you have anything to add? Okay.
I could add a comment.
That's nice, thanks.
Yeah, a part of this program includes the 200 hours of CRC support. If any of you guys are wondering what that support might look like or have questions, we have an intake form that I could provide a quick consult to show you what our services can provide. And I would actually recommend it if you're thinking to apply, just to see if what the 200 hours could help you with in your projects. So I just wanted to shine that.
Great idea, May. Thank you. And one other aspect of the application, you must be master's or doctorally prepared to apply for this funding. I just wanted to add that.
Can you tell me, well, I know last year you had two recipients. Do you know how many
Yes.
you'll be able to award, or does it depend on how many people submit a letter of intent?
No, we usually we can only fund 2.
Oh, okay. Okay.
Yeah, so we're pretty restricted on that.
Okay. And then so based on who submits a letter of intent, then the committee will choose the 2 that they will offer the opportunity to apply. Is that correct?
So the letter we can get a lot of letter of intents, and we can invite as many as we want to submit a full proposal. So for example, last year, I think we had about 11 letters of intent. And then of those 11, the review committee invited about 5 to go ahead and submit a full proposal. And then we pick 2.
And then you pick 2. So you don't find out until like sometime, I guess, in June, like whether you've actually gotten it. Okay.
Exactly. It seems far away, but it'll come fast.
And it's okay if it's a research study that is currently ongoing, but we need extra support. Like, is that eligible?
It has to be an original idea that could be, if you're doing, you're part of a parent study and you're doing something, different, but it has to be something original within maybe another study.
Well, the study is original, but we're already doing it, but we have no funding or no support or any of that. So we thought this might be a good thing, but I don't know.
Yeah.
Like we already have IRB approval. We're already running the study.
Right.
So like, I don't know.
So I think the project that you're going to propose would be novel, because it's already part of a study. So it's not just that you have a study and you need the clinical research support. I don't think that would qualify.
Right.
Oh, I see. It has to be like some sort of new part of that.
A new idea. Yeah.
Huh. Okay.
Yeah. Is it Ronit?
Yes.
Ronit, I was wondering, are you you're a genetic counselor? Are you at Stanford Children's?
Yeah.
Oh, good. Okay. Because we did have someone last cycle that I think was a Stanford.
Stanford
University.
Healthcare, or Stanford Healthcare. Actually,
Yes.
Fiona, one of the recipients of last year's award, is actually in the fertility clinic. She's
Yes.
yeah, I know her very well. So.
Okay. So
Yeah.
great.
Yeah.
Great. I just
but yeah, what she did was like a totally new thing.
Yes.
And I was encouraged by by one of the doctors who's helping with this current study that we're working on. She wanted me to apply for this mostly for the support, but sounds like it might not work. So
yeah. I mean, you could discuss with that person, is there something that could come out of it, another novel idea that you could somehow, create from that. But we are pretty selective on that. We want it to be your idea, your, sort of your inspiration.
Yeah. Okay.
Yeah.
If you could give advice to some of the applicants that applied last time but didn't quite get through, what advice would it be?
Gosh, that's a good question. One of the, and Kim, you can help me out on this, but I think a common theme that we found was the feasibility of doing something. We take really a pretty big consideration to. Is it possible? Is it feasible? Are they going to be able to recruit this number of patients? And is it realistic that they'll be able to get those numbers? I don't know, Kim, if you, we also, there was, we have very concrete critiques of the proposals, but it was so long.
Yeah, I was
remember
I was
exactly.
actually looking through. If you give me a minute, I can,
Okay, thank
yeah,
you.
find some.
We'll come back to that, Eric. Good question. Music therapy team, you've got to have a question.
Yeah, just can you go over the requirements for the mentor again?
Yes. So you have to have a mentor that has an academic appointment in the School of Medicine. So yeah, a physician or I don't know if you're doing something with, but it has to be I don't know if we required, Kim, if the mentor has to be Stanford Children's, like could they get a PhD in microbiology or something like that? But I think I don't know that for sure, but it has to be someone who has an academic appointment. And for us at Stanford Children's, it most likely would be a physician you work with.
Yeah, but it doesn't necessarily have to be Stanford School of Medicine, or is it specific?
Yes, to Stanford. It has to be Stanford.
Stanford, but does not. It can be outside of the School of Medicine.
Right.
But they should have experience doing research. Yeah.
Gotcha.
And just for some comments, I think that like power analysis came up. So you do need to, if it's appropriate, meet with a biostatistician. Talking also, Annette mentioned feasibility. And things like, depending on your project, thinking about DEIJ, there was a study in with patients, but that was like specific to the study DEIJ. But if let's see, one of the questions that came up a lot is how the data would be translated to care and how it would impact care. Like that's really important. Let's see what else. I think yeah, those are the biggest things I saw in terms of in the comments and recommendations, things to consider.
That help, Eric? Okay.
And just so you know, you will receive comments if you are, everyone will receive comments, whether or not you're invited, but you will receive comments if you are invited to submit a full proposal that will help you when you're preparing your full proposal submission.
So we'll know how to improve in the future.
Yes, yes.
Or if you're selected to write a full proposal, we'll also give you advice on how you can make it stronger. Right. Let's see in the chat if there's anything.
Yeah, someone asked about how many awards would be granted. I said 2.
Oh, great.
And then, yeah, and Joe, just to, this has come up again. So student projects are not allowed for this mechanism.
Right.
And what were the areas of particular interest again?
Sure. Let's see. Hold on. Let me share again. I got it right here.
Yeah. Oh, you have it? Okay.
Yeah. let me just. They're right here. And these were actually recommended by our Chief Nursing Officer, Dr. Sapero, and the Executive Director of the Center for Professional Excellence and Inquiry, Dr. Taylor. And these were the topics that they were trying to align with hospital goals and initiatives. Can you see those, Eric?
I do, and I see them on the website. They list them as examples. I didn't necessarily correlate that they needed.
They
were
don't have to be. They
recommended.
don't have to
Right.
be. It's just suggested.
So tag on question then, especially with AI, what's our current resources for that? Because you could easily and very quickly break a $5,000 budget if you're going from scratch with AI, right?
Yes. So you have to be pretty clever on how you're going to design a study, which you're only using $5,000 for, right? Yeah. So might not be able to do as much as you want, just having to scale it down and do a small pilot study or something like that, where you're not having the numbers that you may want to have. That's a tough one. Maybe one day Eric will have a lot of money to do all these big studies, right? If you want to ask me just about some sort of ideas you're having, or just want to say, hey, I'm thinking about this, does it even sound appropriate? I'm happy to address any questions like that. And the importance of building a team.
Hi.
Yes.
I'm sorry, I may be very new at this, so my question is probably not appropriate. But for the list of research area examples,
Yes.
the fourth one, patient care models in the inpatient
Yes.
or outpatient. But then the exclusion criteria down where it says student research projects are not eligible, and it says quality
Correct.
improvement projects. So if you are talking about patient care models and improvement in that area, would it not touch quality improvement? Or how do you differentiate between the two?
It might hit quality improvement in that this funding source is only for research, not quality improvement. So it has to be something original. It has to be contributing to generalizable knowledge. Not necessarily, if you do a qualitative study, it's not going to necessarily be generalizable, but we do want something new that's never been done before, that's not in the literature. And quality improvement is usually taking research and implementing or translating it to the bedside and seeing outcomes that are unique to your organization, right? Does that make sense?
I think it does, yes. I didn't look at it like that, and I'm glad I asked. Thank you so much.
Yeah.
I have a follow-up question if no one else had anything, because I know I've been talking a bit.
It's great, Eric.
So who would a good go-to person be to determine like a rate of population? So for example, if I'm looking to initiate a care model for a historically disadvantaged community, who would be a good person to ask to see kind of what the actual rate we see that community? Because it might not be realistic to implement a project for a population that we only see 5 of a year. Does that make sense?
Yes. I'm wondering, so sort of, Eric, if I'm understanding you correctly, where do you go to find data on possibly demographics in the patients we serve?
I think that's a much better way to put it, yes.
Yeah, and I think that there's probably a variety of places you could go to get that.
I can chime in a little bit, Annette.
Sure, thanks, May.
Yeah, for some of our projects, to find out if a study is feasible and to know if there's even that population to recruit from, we have, Stanford has this platform called STAR. And I don't know if you guys are familiar with it, but it is a platform that you can request the service to, you provide them input of the population you're looking for, including demographics or a condition, a diagnosis, something of that sort, and they could provide you without, with or without PHI, the number of that population available to you to recruit from that has been seen here at Stanford.
That sounds exactly what I'm looking for. How can I find them to make that request?
Yeah, let me see if I could put it in the chat, or I could email you directly or this group after. It might take me some time to look for it.
Great. That's a great idea, May. STARS would be super good place to go. I don't know if you just, I don't know if you go to Stanford Medicine. I bet you May will find it and she can share that with you. That'd be great.
Appreciate it.
Yeah, it's a great question. There it is. It's called STAR, STARR. Any other questions? One of the other things we have to make sure of is whether your managers are supporting the time away from the bedside for you guys too, which usually it shouldn't be a problem, but sometimes takes a little negotiating. But it's 200 hours for the 18 months, which isn't usually too much to lose from a department. Hopefully. It would be really great to, there it is. Thanks, May. Anything else? If you want to have any consultations or just want to run an idea by either Dr. Kim Pike-Graham or myself, please just complete a consultation form. We're happy to meet with you. Love to see some applications coming from all of you. It'd be great. It's a wonderful opportunity. It's not every day that you get some time away from the bedside to do research, and that's what a real cornerstone of this funding source is really creating that time for clinicians to answer questions that have never been answered before and contribute to research and the science. Okay.
So
Anything else, Kim?
I was just going to say, you can email the general MCHRI admin email address if you have any general inquiries, and I can forward those to Dr. Nasser and Dr. Pike-Graham. Also, we'll send out to the group, we'll have the recording up. We can send the recording. I'll also include the links for STAR and the consultation link for Dr. Nasser and Dr. Kim Pike-Graham as well.
Thank you. That's great. And is there anything else? The chat. So thanks. So May put the address. So that's great. The link for STAR, which will be good for Eric. All right. Well, thank you for attending. And May and Kim, if you could just stay on the line for 1 second after, it'd be great. And again, any questions, please just send us a consult request.